What has sex got to do with healthcare? Everything?
Welcome to Getting Into It, a video series where we talk about better sexual pleasure and consent for women and gender diverse people with disabilities for healthcare practitioners.
And this ranges from primary healthcare practitioners such as GPs to allied healthcare practitioners such as pharmacists, physios, and occupational therapists.
If you're working in community with women and gender diverse people with disabilities, then these videos are for you. I'm your host, Dr. Lena Molnar. I use she, her pronouns, and I'm a gender-based violence expert.
And I'm Hetty McCalla. I use they, them pronouns, and I work in sexual and reproductive health promotion, where I focus and specialize on talking about sex, sexuality, and pleasure with community and health professionals.
Before we get into it, I'd like to respectfully acknowledge that this video series was filmed on the stolen lands of the Wurundjeri people of the Greater Kulin Nation. Just a heads up, the following video series contains content that may be distressing for some.
And in this video series, we're excited to be joined by 4 experts who will be sharing their lived experience of disability and their perspectives on these topics. I think there is often the assumption that people with disabilities, especially women and gender diverse people with disabilities, don't have sex or they're considered asexual, but we know that that's not true.
Where do you think that idea comes from?
I think it really is embedded in the medicalization of people with disabilities. People that are considered outside of the norm aren't considered to be sexual beings.
It's not so much there's a perception that we're not having sex, they're just not thinking about it and they don't want to think about it.
Yeah, and they think it's not a priority.
Yeah.
And that everything about your life should be about the disability and you can't possibly have time or passion or want sex in any way, which is just not true.
People definitely don't think I'm having sex because they don't see me as a sexual being. They see me as a medical problem to fix. So it's 2 separate things and they don't merge.
I personally don't feel that people assume that I don't have sex or I'm non-sexual, but I think that people are afraid to talk about sex and disability. I think that practitioners might be afraid to talk about sex and disability because people sometimes want to protect us. They want to respect our boundaries so much that they just don't go there, rather than engaging in respectful conversations about us, about the kind of sex we would like to be having.
When practitioners don't even consider sexual and reproductive health, you're really missing out on a whole set of data and information from your patient.
Trying to have an open conversation about sexual pleasure means that practitioner can support a patient to find out other causes for their pain or other causes for their tummy ache. They can maybe be a better practitioner.
Definitely. Taking that holistic approach as well, because our sex lives are important to people and how we express our sex and sexuality is important.
My doctor has actually never spoken to me about sex, really, never checked in the last couple of years. Neither does anyone. And I don't know if that's because I'm disabled and they're just assuming it's not happening, or if they're just like, oh, you'd tell us. I remember one time I did ask for a check for my health and they were like, oh, why do you need that? Like, why do you think?
The way people view my disability, it's often very infantilized. I'm not a child. I am aware of my own activities and what I can do. I'm aware of my body and I'm aware of what I am. And, you know, I still have the same biochemical urges as everybody else my age. Why aren't you talking to me about it? Like,
And also when we have a look at what the evidence says about underreporting and underservice for women and gender diverse people with disabilities, folks aren't accessing the same amount of sexual and reproductive health services or getting tested for illness and disease with regards to their sexual health as the rest of the community. A big part of that is because of accessible service, but also because of the stigma around their sexual health.
Agreed.
And so if practitioners don't think that we're having sex and aren't delivering the service in a respectful way, then why the hell would we get tested?
Exactly. And sometimes you don't know that you can bring up a topic if your doctor or practitioner hasn't even made it a safe place for you to bring that up.
Not being able to get information from practitioners, I had to get information myself when I eventually gained confidence in my 40s. So before that, I didn't really have much information.
What has sex got to do with healthcare? Everything? Beyond the risk of like transmission of STIs, which is like the basic, it has impacts on physical health and mental health, social and emotional well-being. I thought we were moving towards like a holistic view of health. That's my like gold standard.
In sexual and reproductive health conversations, it can be a really good opportunity to screen for violence and other unsafe relationship practices that are happening. And it's really important that we use those opportunities for that, because sexual and reproductive health can be used in a coercive manner and in a violent manner in relationships. And when we're not assuming that people are sexual beings or they have intimate relationships, you're really bypassing all that information and you're missing it all out.
I think shame is a really, really big part of it. And I think just by showing that compassion and that understanding, it means I don't have to feel bad that I was, sexually assaulted. Like, you understand and you're going to help me no matter what.
When you're working in a healthcare practice, you are a gatekeeper of a system. You got to recognize that there's power involved in that, and like not to go gun-ho and get into it all at once, because there's power in having these conversations and taking your time with it and knowing where your client is at and how they're engaging with the system and what you can do to alleviate that pressure at any given intersection as well.
Definitely, yeah.
If anything you have heard in this video has brought up distressing feelings, please call 1-800-RESPECT. For more information or other resources, feel free to visit the Women with Disabilities Victoria website at wdv.org.au.